Assalamu alaikum viewers. Here's Dr. Munir Abbasi from Daniyal Ultrasound Clinic. Today we are here with another important fetal ultrasound case. Today's scan is of a patient who is approximately 6 to 7 months pregnant. That is around 24 to 28 weeks of gestation. On this obstetric ultrasound, we are going to discuss two major findings which are seen in this fetus. One is posterior encephalocele and other one is bilaterally enlarged echogenic kidneys with multiple tiny cysts. Now let's go step by step and understand what we are seeing here and how to identify it on ultrasound and what are the possible implications. Firstly, we are going to study the fetus and its general findings. Here is the placenta lying anterior. Here is the fetal head, cephalic presentation. This is urinary bilateral longitudinal section. This is fetal abdomen. This is fetal heart. Here is the fetal femur. This is femur length. So, and liquor. Here is the liquor. So, there's no specific abnormality with the liquor, placenta, fetal spine. So again, let me describe it that fetula and positions are normal. The fetal spine appears continuous and intact. There's no spinal dysraphism. The amniotic fluid appeared normal. It may be slightly decreased due to the fetal renal dysfunction. Now we will focus mainly on the cranium or cranial and renal findings today. So if we look at the fetal head, we can clearly see an abnormal finding here. Here it is. This is a posterior encephalocele, which means part of the brain tissue or the meninges are herniating through the defect in the skull. And there's a defect, as told you, in the occipital region of the skull. Through this defect, a sac-like protrusion is extending posteriorly. This is called, I told you, a posterior encephalocele. Now on ultrasound, the sac appears as a cystic or mixed echogenic mass continuous with the cranial vault. Sometimes we can even identify brain tissue within the sac, but here we do not see brain tissue in the sac. Here it is. This is the cervix, endocervix. This is the fetal head, which is showing discontinuation in the occipital region here, from where this sac is herniating and forming a, let me magnify the image to understand further. Here it is. Here is. So it's very important to confirm continuity with the skull defect and to differentiate it from the other cystic structures like cystic hygroma. It usually appears near the head and posterior. It's located though in the posterior part of the neck, but sometimes it gives trouble to the sonologist. Now let's go to the fetal kidneys. Here is the abdomen. Here is the fetal kidney. You see here. Both kidneys are enlarged. They are bright and hyperechogenic. Within the renal parenchyma, you can see numerous tiny cystic spaces scattered throughout the parenchyma on both sides. The renal outline is still visible. This is the renal outline. From here, you see this is the renal outline. It is still visible. But the corticomedullary differentiation is lost here. So these findings are typical of infantile polycystic kidney disease. This is also known as autosomal recessive polycystic kidney disease, ARPKD. So in this condition, the collecting ducts are dilated, giving this echogenic and microcystic appearance. Usually the urinary bladder, as we do not see, cannot find the urinary bladder though. This is because the urinary bladder is not visualized because of the poor function of the kidneys or urinary production, and the amniotic fluid volume sometimes may be reduced, but here it is normal. It's not oligohydramnios. Now, when you see, let's again go to the posterior encephalocele. When you see posterior encephalocele along with bilateral polycystic kidney disease or kidneys, it raises suspicion of the syndrome. What I mean is, most commonly it's Meckel Gruber Syndrome. This is a rare autosomal recessive congenital disorder, though, and characterized by a triad of occipital encephalocele, bilateral polycystic kidney disease, and sometimes polydactyly. Polydactyly is multiple fingers. So here we do not or cannot find it because the fetus is quite pegged with the uterine surface, and limbs are though poorly visualized, but we will try later. But let me explain few important points again. And to summarize, actually, the posterior encephalocele and bilateral polycystic kidney disease, infantile, and maybe there may be another abnormality. So, in such conditions, actually, these are unfortunately incompatible with long-term survival and should be discussed sensitively with the family. And always we should document these findings properly and save images in multiple planes, and advise a detailed fetal anomaly scan and genetic counseling as well. So thank you very much, viewers, for watching this long video